So it is that time. Ladies and gentlemen, welcome to all of you who have joined us today. We're so glad you could. For this timely topic, it's something that we try to cover at least once a year. And today we are so pleased to have with us an expert on this topic. I'll introduce him in just a minute. So the topic for today is be vigilant with protecting your patient's health information. Be prepared and be protected. Thanks. So I am Phoebe Nelms. I'm the Associate Program Director here at Hybrid Solutions at the National Center for Primary Care, Morehouse School of Medicine. And our special guest today is Ariane Parham. He's the co-founder and compliance expert, and his company is Ham Tech Solutions. So we're really glad he's going to share the real world experience that he has had and how he uses it to fuel his passion for protecting your health information. So you know who we are. We're Georgia's Health IT Center for helping clinicians really to advance interoperability. And there's so much potential in how we use the information that's gathered in electronic health record systems for managing transitions of care. And as CMS wants to move more to value-based clinical models, that information can also be used to provide better health outcomes for patients. We're located here at Morehouse School of Medicine, and our executive director for the Health IT Division is Carmen Hughes, and the executive medical director for the National Center for Primary Care is Dr. Dominic Mack. So what are we going to really dive into today? We're going to review why it is so very important. It's a vital need to protect patients' health information. And technology is always on the move, so it's never the same. There's certain things that remain the same and true, but there are changes that are coming that we really want to keep you abreast of, and also just keep current in how the environment has really created the need for vigilance. And we'll, of course, review HIPAA reminders because this is something that whether you are in an incentive program or not, HIPAA applies to all medical practices. So as we move forward, I will turn it over to Ariane, and maybe you can tell us a little bit about yourself and what you do as you go through your presentation.
Yes, definitely. Thank you so much, Phoebe. My name is Ariane Parham, and I am, as she mentioned, the co-founder of Hamtech Solutions. And thank you for that, compliance expert. Um, so I've worked with a number of practices throughout the years, just helping them with their HIPAA compliance. And so before I get into the actual presentation itself, I wanted to share why this is important. And prior to me starting Hamtech Solutions, I was in a practice for 7.5 years. And during that time, I lost over $100,000 as their IT manager. And it was for something very, very simple. If you're here, then of course you should know about the macro MIPS program. But in the beginning, it was called Meaningful Use. And when it first started, it was just an incentive program. You could mention that, hey, I'm going to install an EMR, and you would receive an incentive for that. Well, after some time, it transitioned from being like, hey, this is a good thing to now it's required. And so during that transition period, the requirement was that you just complete a form for all of your providers. And for whatever reason, with the many providers that I was managing, there was just one that I just missed. And if you are like I was, where you wear multiple hats, things unfortunately can slip through the cracks, and that was one of them. And I was a friend to the managing physician at the time, and he sat me down and he said, Arian, I'm grateful for all the things that you've implemented, the efficiencies, the technologies, you saved us money. You've done great, but this has sort of wiped out a lot of the good that you've done. And that was tough for me. That really hurt. Because again, like I said, I had a personal relationship with the managing physician, and to know like that there was no way to get that money back because it was a penalty from meaningful use. And so unfortunately, we lost that money. I stayed on for a bit after that, so I didn't get terminated. But again, it was just bad. And so I don't want that to be your story for the individuals that's on this call today. And so we're talking about being vigilant and being prepared and protecting your clients. And so that's why, if anything, right, you should listen to this presentation today. So what are you actually protecting? You're protecting the patient and the patient record. That record includes a wealth of information that a number of people can use to steal someone's identity. That includes social security number, date of birth, um, typically your family history. If you've been going to the practice for some time, then you have a history of addresses. Essentially, everything that you need to steal someone's identity is within that record. And so it's important for us to protect that. And by protecting the patient, we're able to actually protect the organization and ourselves as well. And so anytime that there's a hack or anything happens, it affects the reputation of the organization. And not only that, you have to deal with the decline in revenue, possibly because of OCR fines or legal fees, or just the different things that you have to implement if there was a hack. And then lastly, yourself, depending on the severity, and if it's found that you as an individual was responsible due to your negligence, it could be termination all the way up to potential penalties and jail time for yourself personally. So we want to make sure that we're doing everything that we can to protect the medical record. And not only that, it's when patients come, there is a level of expectation when it comes to confidentiality. When they sit in that exam room, they're sharing personal details, right? Personal details that they may not share with their spouse, partner, parents, or children, depending on what the ailment or what they're being treated for. They're sharing that personal information. And so there's an expectation that that information is going to remain confidential. So it's important that we protect that. And so I don't know if you guys have ever seen this, but this picture is from YouTube. And if you are like me and you're tired of receiving those robocalls all the time, there's actually a YouTube out there, the guy in the blue, where he will allow scammers. He plays the victim. And so when scammers call him, he'll give them access to his computer, not knowing that as they're accessing his computer, he'll like remote into their computer and then find out information about them, their names, and then he'll start, as he's playing along, he'll start to mention the person's name, the manager's name, where their location is. And of course, the scammers, they start to get scared. They're like, oh no, oh my gosh. And so I wanted to show that. I wanted to mention that because as you see in the picture, they're in an office, right? So malicious actors, it's no longer the guy in a hoodie in the basement at night on his computer all day. There are actual companies, businesses, organizations whose job it is to steal information. That's their actual job. And so some of the things that they may use, some of the tactics they may use is phishing, and that's fraudulent emails. If you've ever seen those spammy emails where it looks like it's from the bank, but it's not, and they're asking you to click on a link, that link will typically download software on your computer and allow them to access it remotely. And so we want to be mindful of that, beware of that. Malicious software, viruses, depending on websites that you go to or the different things that you download, whether it's a PDF, Word document, various things. We want to be vigilant when it comes to downloading and clicking links. Ransomware, locking patient files for payment is typically what that is. And there's so many practices that fail for this particular incident. And if you're familiar with what happened recently with Change Healthcare, that was actually what happened. It was a ransomware attack to the point to where United Healthcare actually ended up paying millions of dollars. And the reason for the long breach, or allegedly, they did admit some things, but allegedly, the reason why it took so long to reactivate or install some of these other softwares that they had turned off was because the malicious actors wouldn't turn over the data that they stole. And so, yeah, it was crazy. So ransomware, it's a real thing. And so the other thing is spyware, and keyloggers is a type of spyware. And nowadays, because malicious actors, again, like I said, it's a 9 to 5 for them. They realize that people aren't really clicking on these emails. And so what they will do is they will get on your computer and they will just watch what you do. They will monitor what you do. They will monitor the types of emails that you send and the language that you use, and so that they can send an email to somebody else within the company and they will click on the link and have access and escalate throughout the process. And I believe that's also what happened in the Change Healthcare situation where it was a breach through email. Again, this is all allegedly. So
That's pretty interesting, because it was the implications and the reach, as you said, was just so very far. So many, healthcare organizations were impacted by that. Um, I work here at Morehouse School of Medicine, and doctors and lawyers and students, but in when they do the tests as to who will click on the malicious emails, IT
mhm,
does a test every once in a while. We never
mhm,
know, you know. Um, and then they send out a report as to how many people fell for the malicious test.
mhm,
Um, so it's just can't be too careful. I guess it's the lesson I get from that. So
yes.
every email I'm like, I don't know who that is.
All right.
I'm not
And
clicking.
exactly. And that's the attitude. And and it's important because I know a lot of times this also works off a person's tiredness, because when we're tired, we just start to click through and we're on autopilot. And sometimes it's just like, but when you get that inclination, it's just like, just stop, pause, review, go ask the person like, hey, did you really send me this email? This you don't typically send me emails like this, or if you do, then you'll talk to me first. So if you ever get that inclination, definitely.
Yeah, I want IT to get sick of me. I forwarded to them and said, "Is this legit?"
Right, exactly. Exactly. Yes. And so, unfortunately, with these attacks, if you are negligent, right? If you become aware of these things and you don't implement the proper policies and procedures, there are penalties from HHS, from violating HIPAA. And so the tiers are based on your level of knowledge, whether you knew about it or you didn't, or you knew all the way up to you knowing about it and you willfully neglect it. Like, they presented you with this information and you still didn't fix it afterwards, and there's penalties for that.
Did
And
that
also,
last column
mhm,
say
yes,
1 million plus dollars
whew, yes.
for a small practice?
Yes.
But they don't go after small practices, do they?
No, they do. They definitely do. They definitely do. They definitely do. Especially with the most recent one. I was actually surprised with this one, but last year they spent the majority of last year going after refusal of medical records requests. And so there
Mm.
was a number of practices that got hit with like a 30,000 fine for one patient for not responding to their medical records requests within a timely manner. And so, and that it was a number of smaller practices, 30,000, 40,000, so forth and so on. And so it's definitely a real thing. And as we can see here, again, these are cases where the actor was inside. It was an employee that actually stole the information. So we want to consider the outside, the external, but we also want to be vigilant when it comes to the inside. And one of the things actually at the practice that I was working at the time that was really sad to find out. She would she worked at the front desk. She was a
Mm.
medical receptionist, and she would collect patient payments for their deductibles or bills. And one of the things that she would do was after she collect the payment, she would print them the receipt to show that they made the payment. And then she would go and delete the payment out of the system. And we didn't know for some time until there were a number of patients saying, "Hey, I paid this. Here's my receipt. Like, what's going on?" I mean, after the first patient, you would think, okay, maybe there's a glitch in the system, glitch in the EMR system. We need to call somebody. But then there were a number of patients saying that they paid their bills, and unfortunately, it didn't
Oh,
show.
so was this like if they paid cash for their
Yes, exactly. If they paid,
Oh,
and so
okay.
she would pocket the cash, and yeah, it's just it's kind of sad because you just never know what people are going through. And you most of the time wouldn't think that the person that committed that crime or committed that violation would be that person. That's Susan
Mm.
or Becky, or like the person that brought cupcakes for everybody. You just never know again what's going on. So we definitely want to be prepared both internally and externally as well. And so the question of can I get hacked? It's no longer a question of if, but more so when. So regardless of the size of your practice, and I know again previously we could say, oh, it's a smaller practice. No one's coming after us. No one is going to try to hack our systems. But in 2024, things are so much more different. Just like we have robocalls that we get on our phones that we really don't like, they also do that via internet. And so they will just send out attacks and scans just on the internet randomly, and they will see which computers happen to be vulnerable to that particular attack. And so once they get access to the system, then they're able to find out, oh, it's this organization or that. And so it's no longer just, I'm going to target this one particular company, but it's more so, how many companies can I get with
Oh
this
boy.
particular attack? So
And
again,
I heard
mhm.
I heard somewhere
Oh, go
that
ahead.
the price for healthcare information is exponentially higher than even financial information.
Mhm. Yeah, again, because the wealth of knowledge that's in there, you pretty much have everything you need to know about a person is contained within that medical record system. And so again, it's no longer if, it's a matter of when. And so
Okay, so
we
give us some good news because you just done
yes.
gave us so much bad news.
Right. I'm sorry. I'm sorry. So now it's like, okay, so how do you protect your practice, right? So now we understand that this is a real thing. It can happen to us. How do we actually protect our practice? Well, it starts with understanding the HIPAA rules, the privacy rule, security rule, breach notification rule. HHS has really done a good job on their website, as well as providing like other resources, guidance material. So even if you don't go back and read the actual rule for itself, they've provided enough summaries and FAQs to help you and your practice be successful when it comes to HIPAA compliance. And so after you have somewhat of an understanding, you want to either you can do it yourself, but I would recommend bringing in someone to perform a HIPAA risk assessment. And so, what's required by HIPAA is a HIPAA security risk assessment, but I would also recommend including the privacy portion as well. And the purpose for that is because you want to be able to find the gaps within your system. A HIPAA risk assessment is a good thing. You want it because you want to know where you are falling short. So anytime you're completing the security risk assessment or HIPAA risk assessment, you want to make sure that you are completely honest. Because if you say that, hey, we're doing this or we're implementing this and you're not, then you miss out on the opportunity to fix that issue or to mitigate that risk. So you definitely want to be as honest as possible. And again, like I said, it's a good thing. And so once you find those gaps, you're able to create and implement the different policies and procedures. And so we want to make sure with the policies and procedures, and hopefully, I don't know if I'm calling anybody on calling anybody out on this, but if your policies and procedures are in a notebook on the shelf and they have dust on them, then we want to make sure we actually open it up, look at it. If we purchased a template from somewhere or got a template from somewhere, we want to make sure that it actually matches what the practice does. And so by implementing these things, and this is like an ongoing thing, by implementing these things, then you will definitely be prepared and protected. And so when it comes to HIPAA compliance, HHS is not the boogeyman. They actually want to give you resources to protect your organization. Because again, like we talked about, just the bad actors, so many people, we want to make sure that we do everything that we can to protect that. And so an example of a policy is here. This is in the privacy rule, 45 CFR 164.520. It says a covered entity that maintains a website that provides information about the covered entity's customer services or benefits must prominently post its notice on the website and make the notice available electronically through the website. And so this particular standard is again from the privacy rule, but it's referring to the notice of privacy practices, that document that we give to patients every time they come to the office. And so if we were creating a policy from this, we would say Smith Family Practice will prominently post its notice of privacy practices on its website and make the notice available electronically via download through the website. And so if you currently have a website and you don't have your notice of privacy practices on there, then you definitely want to make sure you get it on there. So,
I used to visit a lot of practice websites, and I really don't remember seeing this on maybe two I've seen, but not most of them. So that's
mhm,
actually a violation.
this is a violation. So we want to make
That's a
sure.
good piece of information.
Yes. And it's something that again HHS is actively going over after this now, and we're going to talk about that later when we get to the HIPAA updates. But we definitely want to make sure we are adding this to our website if we have a website.
Excellent.
So some examples of security requirements and recommendations. Strong passwords. Strong passwords and these things, they may seem simple, but by implementing them, you will save yourself from a lot of headaches. So implementing strong passwords and changing them regularly is so important. Having antivirus software, making sure it's up to date and that you don't disable it, right? Having it on there, having it installed, getting with your IT guy, making sure you have a firewall in place. Like I mentioned before, where again, companies are sending out these mass attacks by implementing or having a firewall, it prevents a lot of those things. And so having that is good. Controlling access to PHI, you want to make sure if, depending on the size of your organization, that only the select individuals that need access to that patient's record at that level have that level of access. Controlling physical access to your facility. Not everyone needs a key to the office, right? And so we want to make sure only the individuals that need access have the access that they need. And that includes limiting network access, whether it's files, folders, not sharing files and folders with everybody, or making sure that depending on how your network is set up, that you require a username and password to get into the system before you get into the EMR, are just some examples of that. And big one, breach response plan. This is so important that
So if you go into somebody's practice and you say, "Oh, what's your brief response plan?" and they say, "Oh, what's that?" You know you got some work to do.
right. Exactly. And it's so important to have this because, like I said, it's not a question of if but when. And I know I keep saying that and re-emphasizing that. It's just because things are just happening. And so when it happens, you want to know who to call and what to do. A lot of times, again, going back to the Change Healthcare situation, the reason why access was gone immediately was because that was a part of their response. Like they see the system getting attacked and they just to end any other lateral damage. It's just like you just shut the network off completely. And so depending on your size, that may be the case. But so you're not panicking, you know what to do when anything happens, whether small or large, that plan is very important. And so also having sanctions in place for violations when employees or staff members violate HIPAA, you want to be able to clearly state that depending on the severity of the situation, it may mean a verbal warning, the employee being written up, or actual termination. And so you want to have that in place as well. Backups, and this is new because now the majority of practices use an EMR. And so this is something that they can offboard to the EMR company. But you want to get verification. You want to ask them about their backup policy. Ask them to send you documents or information about their backup procedures, which would be really helpful for you to know in the event if anything happens, you know who to call, you know what to do. Maintaining good.
Especially, oh,
Uh-huh.
I'm so sorry. Especially if you might need to access, if you're, well, I'm always thinking about the quality payment program. And if you by chance need to access something from your EMR and you cannot produce it and you're audited, then you're kind of, that's why we say that people should always download their reports and save it somewhere else so that they don't run into that.
Exactly.
Sorry, go ahead.
No, 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 please. Yes. And so maintaining good computer habits. We mentioned this before, not clicking on random links. One of the things that's helpful too is that whenever you're scrolling through a web page or a document, you can actually use your mouse to hover over the link to see at the bottom whether or not that link is sending you to the place that you actually want to go. And so taking that pause and checking is also really helpful. Again, not disabling software, and then not installing software that's not approved by your IT. I know that's an easy one to do, especially when we believe that the software will help us to be more efficient, or this would be great, or this, that, or the other. It's important to know what software is being used and whether or not it's HIPAA compliant. So we want to make sure that we are evaluating that.
So if my IT department hasn't said, "Oh, it's okay to use GPT chat," then maybe I shouldn't be doing that on my work computer.
Correct.
Mhm.
Correct. Yes. And some of these things can be really helpful, but of course, as we're talking about here today, being prepared, being vigilant, it's like Slack. Is it HIPAA compliant? It may not be. A lot of the motion or
You're talking about project management tools?
project management
Okay.
tools. Yep. A lot of these things, we again, they're good tools, they're great tools, and we might use them personally, but we want to make sure if we're implementing them in the practice, if one, they are secure, but then two, if it's HIPAA compliant. And then the last thing is encrypting laptops and mobile devices. One of the great things about encrypting a laptop is that if it's ever stolen, you don't have to report it because they can't get into the laptop itself. Yep. HHS put out guidance regarding that. And so nowadays, if you purchased a computer within the past, I want to say maybe 3 or 4 years, encryption software is included, either Mac or Windows is included within the computer software. And so we definitely want to enable that. Before you had to purchase it and do extra things, and now they've made it so much more easier. You just click a button and then boom, it starts to encrypt the laptop. So we want to make sure that we are implementing that. And so after we've done all of this, after we, I know this is a lot of information, but after we put together these policies and procedures, we want to make sure that we're actually training our staff members and other individuals on what we put together. And so it should include a description about HIPAA, the privacy, security, and breach notification rules. It should include the organization's policies and procedures. And also, there should be some level of cybersecurity updates, including how to protect against malicious activities. And so, one of the things I just want to mention here is that we're really good about 1 and 3, but we miss out on number 2. And guys, forgive me if I'm being like so harsh today. I just want to make sure that we get an understanding on how best we can protect our organizations. And so it's actually required by HIPAA that we train staff members on the policies and procedures. And again, if anything were to happen, HHS is going to ask you for a copy of your policies and procedures. And they may even go so far as to asking the employee themselves, have they been trained? when was the last time they were trained on this particular policy or procedure? And so we want to make sure that we're including that in the training. Before I get into any updates, is there anything else you wanted to add, Phoebe, before I jump into here?
Um, mm, can't think of it. So do you suggest that they also document the training, like have a way to show that they actually did conduct the training every year for every employee? And sometimes it's easy for somebody, to come on as a new staff and you just kind of slip through the cracks that they haven't been exposed to it. I know it takes time. Oh, someone has a comment in the chat. I think the challenge with number, I guess, two is practices knowing what additional policies and procedures are needed. There are very few resources out there. Ah, Tracy, we have something wonderful for you. Hang with us.
Yes, yes, indeed. And so I wanted to just give a few updates. But actually, let me skip to is it okay, Phoebe, if we skip to your portion and come back to these
Absolutely.
updates
Yeah.
really quickly? So I'm gonna
Oh,
skip to
sure.
that slide
Yeah.
and give me 1 second.
Okay, so for our wonderful friends who are Quality Payment Program MIPS participants, we just want to just touch on the things that are in the promoting interoperability category that relate to the information we're discussing today around, being vigilant on protecting patient health information. So one of the things, first thing here is that CMS has updated the Certified Electronic Health Record technology definition to align with ONC's regulations. So they're trying to create alignment across all the programs around what a certified health record has to meet, what criteria. Many of you already know probably that they've increased the performance period from 90 days for the promoting interoperability category, from a minimum of 90 to now it's 180 continuous days within the calendar year. And so, uh, amazingly, the last 180-day performance period starts July 5th. So anything that you need to do to address to look at your PI reports, if you're going to report PI, you want to make sure that everything is up to par and squared away and in place by July 5th so that you can have a 180-day reporting period. And previously, the safer guides where you could say yes, you could say no. But now in 2024, you're required to say yes in response to having conducted the safer guide measure. So that's important. It's somewhat similar to the security risk analysis, but has its own unique nuances, and we encourage everyone to look into that. I'll have a link to the resources in the next slide. So don't say no this year. Just safer. Make sure you do it and say yes. And of course, this is not new, but as Ariane has so emphasized to us, it is an important part of being vigilant is to perform or review your security risk analysis and do so during the calendar year in which the performance period occurs. So sometime during 2024, update your security risk analysis and make sure that you identify those things that might need to be mitigated. I'm gonna, Ariane, you can go ahead to the other slide because the following slide is just my resources, and I'll copy those out and put them in the chat if anybody wants to to grab those. They are the CMS resources and healthit.gov resources for some reference materials.
Okay, nice. And I'll go back and review just some of those updates really quickly.
Okay.
And so one of the updates, if you guys haven't seen, but the Biden administration updated the HIPAA privacy rule to include reproductive protections. And so the new rule states that this rule prohibits the use or disclosure of protected information related to lawful reproductive health care for the purposes of investigating or imposing liability on individuals, providers, or others involved in such care. And also, by 2026, you're going to have to update your notice of privacy practices to include a portion discussing reproductive health care. The next big one, like we talked about with Change Healthcare, United Healthcare, the covered entities that were affected by this. Now this is big because about I want to say 2 or 3 weeks ago, HHS came out and they were like, "Hey, this is a breach," and so because this is a breach, you're going to have to report this breach to your patients. But they just released this, I want to say maybe a week ago, where they are putting the responsibility on Change Healthcare, and this is a huge relief for so many practices. Because now instead of the organization or practice being responsible for sending out notices saying, hey, your medical record may have been breached, now the covered entity can ask Change Healthcare to send out these breach notifications on their behalf, as well as if essentially you ask them and do everything that's required in terms of HIPAA, then your obligations for the breach notification are met. And like I said, this was big because in these situations where you do have a business associate, the covered entity is responsible for sending out the different notices and different things if there ever was a breach. But this breach was so massive and it affected so many organizations that they are requiring, again, Change Healthcare, United Healthcare to fulfill this obligation. And this, if you want to find out more, you can go to hhs.gov. The link is at the bottom. But if you also just search for HHS Change Healthcare FAQ, they recently updated the website to reflect that. And then online technologies. And so one of the things that we talked about was making sure that you have your notice of privacy of practices on your website. Well, also one of the things that we want to make sure of, if your practice has a website, it's important that you ask your web developer to see if they have implemented Google Analytics or Facebook, because HHS and now in they're working with FTC, the Federal Trade Commission, on people that violate this particular rule. Because if you have Google Analytics or Facebook installed or running in the background on your website and you collect information on your website, like if you have a form where patients can fill out information on your website, Google, Facebook, and others can see that information if you have those different plugins on your website. So HHS recently came out with guidance saying like, hey, you want to make sure, like, again, I know your web developer may have implemented these tools without your knowledge, but you want to go back and check to see if they have done this. And if they have, then you want to make sure you turn it off, or you just simply remove that contact portion off your website completely, and you should be good to go.
Always something new.
Yes. And then lastly, AI. All right, we have to talk about AI because that's a big thing now, of course. But HHS has actually been working with AI for some time now, for some years now. They've been looking at how to safely implement it within HHS itself, as well as working with other government entities such as the CDC, CMS, and ONC, just on how AI can improve and we safely use AI. But as an organization, we want to make sure, as you mentioned earlier, ChatGPT, we want to make sure that any AI tools that we use is also HIPAA compliant. And we know as of now, ChatGPT is not HIPAA compliant. And we want to make sure any software that we may use that may have introduced AI, that if you want to continue to use it, that you secure a business associate agreement when it comes to that. Because again, the responsibility is on us to make sure that we are doing everything that we can to protect, regardless of the new software that comes out. So
So, if our EHR company uses AI, then we just want to make sure that they are doing what they need to do.
exactly,
So
exactly.
that, yeah.
Because they can also make mistakes as well. And so, uh,
No.
right. And so again, getting in contact with your rep, just asking them, can you send me your updated security policies? And if you don't have a business associate agreement with them, then you want to make sure that you do. And so I know I gave out a lot of information, and so I just wanted to add this in here as a reminder in case you may have missed it. So the three things, if there's nothing else that you get from this presentation today in terms of HIPAA compliance and being vigilant, it's perform a security risk assessment. And again, you can either do the risk assessment itself or you can do a review, as Phoebe mentioned earlier. And then you want to implement updated policies and procedures, and then you want to train your staff on those policies and procedures. And so, as she mentioned, we have a goodie for today. So, for those who are attending today, I'm going to give a copy of the HIPAA privacy, security, and breach notification template that I use for my clients. And I'm going to make it available to you all for
You told me how long you spent working on this, and I asked you what's like the value that you're sharing. What's the range that, someone might, if they were going to pay for this and not receive it as a free gift for joining Hybrid Solutions today.
right.
Um, what's that value?
Well, yeah, so typically it ranges and it depends on the size of your practice, but it ranges from 600 upwards to $1,000+ for this. And the policies and procedures that I put together, it took me actually 3 months, and I just went back. I started from scratch. I looked at all the original documents back all the way back in 2003 from when HHS was wanting to implement a number of these standards. And so I compared that to what's happening today. I looked at a number of hospitals and other organizations that I know that invested heavily in their policies and procedures. And like I said, it took me 3 months to put this together, but I'm making it available. And so go ahead, I'm sorry.
Oh, no, that's great. Thank you so very much for providing this resource for our attendees today. We know that it'll be great for them. I was surprised at how long it was. But it
Yeah.
also means that you've been extraordinarily thorough. And if they just use it as a guide and create the policies for each of those things, then they will be definitely vigilant in protecting patient health information.
Yes.
I have a question that I need your help with.
Sure.
Um, Sue asked, do we need to get a new BAA from our EMR vendors? I don't think that's what we were saying, but
Mm-mm.
what do we need to just make sure that the vendor has in place for us?
Yeah, we just need to make sure that you have a signed BAA with them. Depending on how long you've been with your vendor. I know I want to say back in 2014, 15, 16, which is when they were really putting out guidance for business associate agreements, and this was a big thing. I know a number of vendors sent out this, so you just want to make sure you have a signed one for yourself. And it's okay every now and then as technology changes to ask them for a copy of their security policies. So that's what you want to get an updated copy of,
The
their security
security
policies,
policies
as well as their backup procedures.
and backup
And
procedures.
this is what you're paying them for. So you want to make sure that you get a copy to validate what they're actually doing. So
Awesome. Do you think most EHR vendors kind of just send it out automatically, or is it something that we have to ask for?
it's something that you have to ask for. It's definitely
Okay.
something that you have to ask for. Like I said,
And it
mhm.
go ahead. And it would be good to be able to lay your hands on it, because I'm sure if you got something in 2015, 16, 17, or whenever you got, it might be hard to. Yeah, so as staff changes, the person who's the security officer might change. And so
Mhm.
just to protect the practice, whoever is the practice manager needs to make sure that you can lay hands on these things if you
Yep.
ever need to.
Yep, exactly. And that's not just for your EMR, that's for any company or software vendor that has access to patient records. You should have a business associate agreement with them.
So just throw out some examples.
That could be your IT company. That could even be your accountant, depending on if they are able to see patient records or not. That could be an attorney, and somebody that you would think you would need one with, but you actually don't, is your janitorial services. They're what's known as incidental, so they may come across a patient record by accident. So HHS specifically says um janitors are not included in that, but
Oh,
yeah, anyone else that has your shred company, if they have access to it, anyone who has access to patient records in order to fulfill a role that you've hired them to do other than your internal staff, um it requires a business associate agreement.
so we always think about, the electronic patient health information when we have these sessions, but I guess it would apply to any paper as well, any medical record. HIPAA
Mm-hmm.
applies to any
Mm-hmm.
medical record.
Exactly.
Mhm.
And this includes your email vendor too, if you are emailing patient records. And so, yep. Exactly.
Wow. Um, One of our attendees says, "This is fantastic. Thank you for sharing the policies and procedures template." All
Yes.
right.
Let me go ahead and
That's
put that
awesome.
link in the chat. And
Uh,
again, not to scare you, but again, as Phoebe mentioned, it is like 100 or so pages. And there's guidance and instructions in there on what to do in order for you to implement it.
okay, so you were able to put it in the chat?
I'm putting it in the chat now.
Awesome. I was trying to help you out. I thought I had.
Oh, no worries. Oops, no, I just sent that to you. Sorry, let me send that to everyone.
Yes. Mine came out as a 20-line link.
Let's see.
Ah, there we go. Awesome. So everyone, if you look in the chat, you'll be able to grab that link. Available for a limited time.
Yes, I was just about to say that. It is only available for you to download for 24 hours, but after you download it, of course, it's yours to keep. So,
Yes. And if you'd like to, stay in touch with Ariane, just let me know. I'll be glad to share his direct email with you. And I think probably is a place on this form that they can get in touch with you if they want to.
I don't know if we included that, but feel
We
free
may not
to
have. Yeah, I'll be glad
um
to.
yeah, feel free to reach out to Phoebe. So, I'm here. I'm available. I'm a resource. So,
Awesome.
and I promise I won't fight you. I'm here to help.
And he even made it so that if you want to put your email address in, you can, but you can still access the download even without providing that information. I think that's a sign of a really stand-up guy.
Oh, thank you.
If you could back up just two
Sure.
slides. Yeah, one
This
more.
one? Oh,
Yeah, that one. So we have some educational opportunities that we really, really would love providers to take advantage of because it helps with it's a training to assist providers in better serving their patients with disabilities. So feel free to take a snapshot of the QR code. Usually I'm able to put the links in the chat, but I didn't prepare that this time. And we can, you know, make this available to you. It's free and you can acquire continuing education credits and also improve your communication with patients who have disabilities who may be part of your practice. And of course, moving on to the next slide, we usually have our webinars every Tuesday, the third Tuesday of every month. And we also offer continuing education through ForMed, through partnership with us. You get a 20% discount and they have HIPAA training and give you certifications,
nice.
proof that you've done it. You don't have to do all the work to create it. It's created for you.
Awesome.
Um, I guess I jumped the gun on this one. So we hope you'll join us again for future webinars. I believe we're taking a hiatus in July. I'm not sure about that. We'll let you know. Thank you so much for joining us, Ariane. You've been wonderful. You've shared
Thank you so
so
much.
many
Thank you.
actionable and valuable reminders and tips with us, and your amazing resource
Oh, thank you.
that you have made available to our attendees today. We so appreciate you, and
Thank
we
you.
wish you all the best for you and yours.
Thank you so much. And likewise. Thank you guys for having me.
Thank you so much. Stay vigilant, everyone.